Comes from listeners like you and Historic Kenwood, presenting Southwest Florida's premier architectural home tour, honoring the centennial of St. Petersburg High School. The February 7th tour features a strong collection of craftsman bungalows, many marking 100 years of history. More information is available at historickenwood.org.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Oh, yes, yes, yes to you, my treasured listener and faithful Monday friend, my cherished good buddy who always keeps your radio dial tuned to WMNF Tampa, your resistance radio station from Tampa Bay to the Gulf of Mexico, and the only shrewd little FM station that Sophia Western streams after she ran away from that rural estate. And you can stream us as well at WMNF.org. Today, Dr. Harvey vouchsafes us another Ask Me Anything Pearl of the Healthy Steps radio show. So you know what has to be done here. Do you have any medical questions? Dr. Harvey has medical answers. Are you burdened by some medical puzzlement? Dr. Fred will try to unravel that Gordian knot for you. You just need to dial 813-239-9663. Sage came in today with no other intention than to take your call. That number again is 813-239-9663. You can also send an email to dj@wmnf.org. You can text us at 813-433-0885. Well, good morning to you, Dr. Harvey. I know that today's show will be quite illuminating and a gateway to an awesome week, so let's get started. What have you lined up for us today, Dr. Fred?
Yes, let's get started. Well, it has been quite a year. You know, it's a year, I think, since RFK was confirmed as the Secretary of Health and Human Services. And boy, oh boy, he's made an impact. Just a little bit of review. His disruption of public health infrastructure and staffing has been amazing. He has had mass layoffs and restructuring within HHS to basically shut down agencies, consolidate agencies. Basically, he's limited our ability to respond to major health threats. He's also caused the resignation or fired major scientific experts, 4 directors at the NIH, top vaccine officials at FDA, and the CDC leadership. He continues to promote the erosion of trust in our institutions that started with COVID-19, has continued. 800 employees signed an open letter criticizing his idiotic decisions. The vaccine issue, that's a big one for me because we have years of evidence that vaccines work. And he fired the entire 17-member Vaccine Advisory Committee on Immunization Practices, and he brought in people that aren't really scientists. They purport to be scientists, but they actually are fake scientists. People, the best example is the people that have published all the apparently bad information about vaccines. Well, the thing is, their information is really sketchy because scientists use other people's scientific expertise published in scientific papers to support the findings in the newly published scientific papers. In other words, real scientists build on the structure of other scientists. Science that has been actually, repeated and proven to be real. But the guys that are now heading this vaccine committee refer to their own publications to support their conclusions. In other words, it's a closed circuit where they make up what's true to prove that it's true. It's a fascinating way of proving that your work is correct by having no dissent and handpicking the results that you create to prove that what you're doing is real. It sounds like deception to me. And these are the guys that are now heading the vaccine committee. One of them had his license to practice medicine removed, and the other one, who's not a doctor, was sued for practicing medicine without a license for treating people. And it's really kind of strange. So he revoked the combined measles, mumps, rubella, vaccinia, which is chickenpox vaccine, prior to age 4 years old. And, there's no medical evidence that there's a problem with this. And so he's removed an important vaccine from recommendations. And now we're seeing an increase in measles. There's another philosophy that it's very libertarian. It's very interesting. Let mothers decide about the vaccines. Well, what we're seeing is that with the public health disinformation on the gram and the book, people are learning that the hepatitis B vaccine is something to avoid. But in all reality, the hepatitis V vaccine is actually an effective vaccine. So it prevents like 90% of perinatal infections, and that's really important because if a mother has hepatitis B chronically, then they can transmit it. This is not as common in America, and so it may not be as important. But here's something interesting about vaccines. They do change our relationship with the environment. They change our immune system. And so if you're given it at birth, you can prevent chronic hepatitis B infection, which causes liver cancer and all kinds of other things. And so it's really an important thing. But here's an interesting one. And this came up with the influenza vaccine, too. If you get one flu vaccine, you lower your overall mortality. Your chances of dying from any cause are decreased. Fascinating, huh? I don't have the statistics on how much on that one today, but you have a 2022 study that found that U.S. children vaccinated at birth with hepatitis B vaccine were 22% less likely to die from any cause. How about that? Any cause. All-cause mortality is decreased by having one vaccine. That's because the chronic inflammation caused by chronic hepatitis B causes damage to all kinds of other organs and can result in damaged immunity overall. And so you might die from something else as it goes on. And there's another one that is happening. There is a significant decrease currently in women taking or having their children get the vitamin K injection. And many babies are born with a state of bleeding because the mother doesn't have enough vitamin K on board, doesn't transfer it to the baby. And so the baby can actually die from bleeding. And the vitamin K study, or the vitamin K actually decreases the risk by nearly like 100%. It's some crazy amount. And the only real reaction would be allergy to the vitamin K. And since the baby's never had vitamin K before, they probably would never be allergic to it. And so there's a very low risk of taking it. But many women are beginning to opt not to have their baby get this helpful vitamin. It's just a vitamin. And so it seems like a really bad idea to skip out on that. And in addition, this is just a mess. He terminated $500 million in contracts for mRNA technology research. Well, we use mRNA technology to fight cancer. So stopping it all is just ridiculous. They're promoting unsubstantiated links between autism and Tylenol, questioning the role of HIV in causing acquired immune deficiency syndrome, and promoting suggestions that antidepressants are linked to school shootings. It's just really amazing what ignorance is being promoted here. Anti-science legislation is just trying to roll back real public health. And it is bothering me because I like to see healthy people. What a mess we have here. Let's hope we can change this soon. In the meantime, let's talk about it. This is the Healthy Steps Show. I'm Dr. Fred Harvey.
Yes, another fine mess. Folks, you are listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. I do have Susan and Gary in the queue, but I'd like you to participate and unburden yourself of your medical questions or concerns by giving us a call at 813-239-9663. Again, the number to call is 813-239-9663. You can also continue to send your emails to dj@wmnf.org. Susan's been waiting patiently, so let's put her on. Good morning to you, Susan.
Dr. Harvey.
Good morning.
Hi. I believe it's been a virus. It's been traveling through my body, and I now still have a little yellow mucus, and I'm a little hoarse, and some of it's coming out clear. I put myself on quercetin 500, 1,200 garlic, and a lot of NAC. Then I went on oil of oregano for a week, but now I'm on andrographis and umca lobo. I'm wondering how long I should stay on those two.
Well, it sounds like you're doing pretty well. I'm not sure those last two are even necessary.
Really?
Yeah, I mean, it sounds like you're on the mend. You've been treating it. Quercetin does a great job for helping heal the mucosa. Garlic may help reduce the amount of bacteria and viruses in you, and so can the oregano oil. NAC helps to loosen your mucus. So if you're already making progress, I'd say keep with the program and just make sure you get lots of fluids. Chicken soup with the cysteine in the chicken broth really helps to improve your lungs as well.
Well, I have to open up my supplements because I can't swallow pills, and I've got about 7 more days of the andrographis. Is that going to be a problem?
No, andrographis is something that can be helpful in antiviral situations, but usually it helps if you start it within the first 2 to 3 days.
Right. But if I continue it a little bit, will it hurt me?
I don't think it'll hurt you. I'm not sure how much it helps either.
So in other words, I can stop this anytime.
It sounds like you're improving already with the regimen you had started with.
What about the fact that I've got little bits of yellow mucus still there?
That happens for almost all viruses. And if you're having clear, it sounds like it's clearing up.
Well, I've got yellow and clear. I mean, I've got both. But how long should this yellow take?
2 to 3 weeks.
Oh, no, I got my thing on December 29th.
Okay, well, nature has its own rules, and most upper respiratory infections clear after about 21 days.
If I have lymphedema, which I do, and I smoked for 10 years, could this be impeding my getting rid of it?
Yes, it may take 4 weeks instead of 3.
I'm past 4. Should I worry?
Oh, okay. If you're that far, you may want to actually see a doctor and have them listen to your chest and take a picture. You might need some antibiotics.
Oh, dear. Well, I got a herpes on my lip, so I think it's a virus. It's taken many forms.
Well, 4 weeks is a bit long for a virus. Most upper respiratory viral infections finish after 2 to 3 weeks. If it persists beyond that, you may have a bacterial secondary infection that is causing a bacterial bronchitis, and that may not clear up as easily, especially with your history of smoking. That does diminish your resilience.
What was the last thing you said?
That reduces your resilience to these things.
I'm 83 years old. It wouldn't maybe take longer.
Yes, all of that.
Oh, God, I can't stand the thought of going to a regular doctor again. No.
Well, if you're still persistent at this point, it may be worth it to have somebody actually look and listen.
Right. My boyfriend, he's trying to get off Solitol because he did have an ablation, and he's weaning himself off it. He has a horrible postnasal drip where he's practically choking on his mucus. I put him on NAC, and he got heartburn, and he doesn't want to take anything.
Yeah. Has he tried a neti pot?
We're both afraid of that. I practically choked with the neti pot.
All right.
Anything else mild he could do?
I wouldn't make a recommendation with his history of cardiac arrhythmia and ablation, and with him doing self-medication and weaning himself off of his medications. I don't want to get involved.
I don't blame you. At this point, would I probably not be contagious?
It's usually within the first 5 days you become high enough antibody load that you're not contagious anymore.
Okay. Thank you very much.
You're welcome.
Appreciate it. Bye-bye.
Thank you
Bye-bye.
there, Susan, and best wishes to you and to your boyfriend.
Thank you.
Let's go to Gary in Clearwater. He's telling me he's cold over there. Good morning, Gary.
Little bit chilly.
Good morning.
How are you guys?
Chilly, but doing it. How about you?
Yeah, I know. I can't believe it. In Minnesota, where they're protesting 30 degrees colder.
Yes. They are very strong people to be standing out in that weather.
Yes. My question is, I looked up and figure of I weigh 160. You cut that in half, and it's 80 pounds. 80 is the number 80. So you're able to. You should drink 80 ounces of water a day. And
that would be good. Try to get 80 ounces a day. Yes.
Now, is coffee and orange juice and milk the same as water?
No, they have things dissolved in them, but they're still liquid, so you do get some benefit there. But clean, clear water, 80 ounces a day is a good thing to shoot for. But if you end up having a glass of orange juice and a glass of milk to help make that up, I'm not really concerned. You're getting fluid.
Okay, that was my question. Thank you.
Very good, Gary. Have a great day and stay warm.
Okay, you too. You guys too.
Thank you.
Thank you there, Gary. Let's go to Tom. Good morning, Tom.
Good morning.
Hello, Tom.
I got to start by saying that the neti pot was invented like 5,000 years ago.
Something like that.
I just looked it up. So it is a miracle of ancient medicine.
Yes.
And if you need it and you aren't using it,
I lost you, Tom.
Well, then let's go to Sandy. Good morning there, Sandy.
5,000 years ago.
Oh, there's Tom.
Oh.
Yeah, I just looked it up. So it is a miracle.
Hello?
Hello there.
Hello.
I think that's
You're on the air.
An echo from Tom.
Okay, let's try this. Tom?
Can you hear me?
Yes.
Wow. That was the most unusual technical strangeness I've ever heard.
Yeah. You went into a little loop there.
Yeah, I did. I heard myself, and I heard another caller come on the line, and here I'm back on the line. I almost hung up on you. So I think it was ending up with you got to try the neti pot. Do anything you can. It's just salt water. You put salt water in your nose, and it kills bacteria naturally.
But actually, if you put a little baking soda in it, it helps to break up the mucus and get that stuff out of your head.
Yep. And a quarter of a drop of oregano oil, and it'll take care of major viruses too. I got two things I wanted to say, and then I got a question for you. And number one, I'm going to repeat that in 2017, Yale University determined that half of all information on the internet is incorrect, and that's just worse now with all the bots out there.
Absolutely.
So if you want to go down a rabbit hole, just start researching things on the internet and don't pay attention to who's self-publishing. There are hundreds of scientific papers.
Right.
I mean, self-reviewing, self-publishing and self-reviewing the scientific papers, because you can prove anything you want to prove with false information. And
yes.
It's just an abundance on the internet. But my second point was I'm a victim of being of super hygiene. I just wash my hands too much. I raised my children hands on. I changed diapers and all, and so I got used to washing my hands. And I found that my left hand, which I wash more often because that's when I get dirty. I got cracks in my skin. And I've had them for, 5 years.
Well, are you using harsh soap?
The cure that I just found is castor oil.
Wonderful.
And
you've stripped your hands of oil. That's the key. Yeah. So you got to oil them up afterwards.
Right. And that's a tip that I think is well worth it. I started putting it on my face here, under my eyes, because while you're using it, why not? So I think that castor oil is highly underrated and
it is
for anybody. I mix it with almond oil because it's awful thick.
Yes, it is,
and that helps it to spread it out. But my question to you is, I'm just so thrilled that you mentioned NAC loosens mucus. I had not heard that before, and my daughter suffers from asthma. She doesn't listen to me because she's my daughter. but actually, she hears everything I say. She just disagrees with it all the time.
That happens.
And I try to get her to drink more water and all this, and I could just hear it in her, and I got her doing all kinds of, I try. She does use the neti pot, thank goodness, occasionally. So give me, me, I'm a list kind of guy. What are the top 5 things that I could recommend that you would recommend for her to when she has that congestion?
Proteolytic enzymes, proteozyme, wobenzyme, take those between meals. They help to, reduce mucus and reduce inflammation, help to change the biofilm in your gut. I think that N-acetylcysteine is a very good thing. Quercetin, also excellent stuff to be using. Vitamin D for everybody with upper respiratory stuff, especially in the winter, and vitamin C. It's not going to treat a cold, but vitamin C helps you build collagen, and so it helps you build structure, so you become more resilient. Another thing, just make bone broth. After you eat your organic chicken, make bone broth from it, because you're going to get cysteine naturally out of the chicken bones, and that is the relative of N-acetylcysteine. So chicken bone broth really helps with your upper respiratory system and helps with your immunity. And
I remember that the vitamin C is an antihistamine as well as the quercetin. So a great list. I wrote them down, and we have it on the archives as well. So I thank you for that, and have a wonderful week.
And you too. Stay healthy.
Yep. Thank you. Bye-bye.
Bye-bye.
Thank you there, Tom. And I do have Sandy. She has been waiting, and I'm going to still invite folks to call on in and participate in the Healthy Steps Radio Show with Dr. Fred Harvey here at WMNF Tampa. Give us a call at 813-239-9663. Good morning to you.
Hello.
Hi, Sandy.
Hello, how are you?
Excellent. How are you today?
Oh, okay. Listen, many subjects so thoroughly. I did want to ask you about one thing, and that is about the debate that's going on now, at least on the internet, about supplements for eye support issues. I mean, I've been taking Areds 2 for I don't know how many years, and it has not helped me with my glaucoma or my macular degeneration, or which is a dry one. And I was wondering, there are several new products that are out on the internet for eye health. Do you have any recommendations now?
Well, the Areds is an old formula that was studied to prevent dry macular degeneration from deteriorating into the wet kind, which is more severe and causes more blindness. And so I think that there are probably better preparations than Areds, but it was actually in a study. You can probably get better forms of zinc and copper and vitamin E. I'm not sure what's in, because different companies make different Ared supplements. But
and they have mentioned something called astaxanthin. That is a new chemical or something that is supposed to help more for.
So astaxanthin is an orange pigment. It's a carotenoid like vitamin A, and it is in krill, small shrimp.
Okay.
It is very popular because it is very good for neurologic degeneration, and the retina is like nerve tissue, and so it could be very helpful there. But there are no magic bullets, and the real key here is to actually not consider that dry macular degeneration or wet macular degeneration is actually a diagnosis, but a description of a problem associated with inflammation in your body. And so you probably have vascular inflammation that is causing the degeneration.
Now, there is a one that has come out, and I've read about it, and it's called Vision MD. Do you know anything about this particular one?
No, and actually I'm trying to steer you away from talking about particular supplements to treat this condition that is actually a description of something going on in your body. And I think you deserve to have someone besides an eye doctor evaluate your vascular inflammation to see what's actually going on behind the scenes, rather than doing Western medicine and saying, oh, look, here's a label for your new disease. Here's a pill to attach to that label. My, oh my, look, we have a supplement that we can use instead of a medication to attach to that label. Sounds pretty much like illness treatment in Western medicine to me. I'd rather do functional medicine and find out why it is that it seems that taking a supplement isn't helping your eyes from degenerating.
Okay.
So I would go to the website Institute for Functional Medicine, ifm.org, and go to the doctor search and find a doctor close to you that does functional medicine so you can get a real workup and maybe change your disease course.
Okay, and so it's Institute for Functional Medicine, are you saying?
Yes. Yes, ifm.org.
Okay.
Best wishes on that, because I really think you deserve to get this worked up instead of just doing line item random treatment, okay?
Oh, and it's ISM?
Yeah, Institute Functional Medicine.
IFM.
Yeah,
okay.
Functional medicine.
Okay, well, I appreciate your commitment to different forms of health care, and for considering that and helping me to understand that a little better.
You're welcome, because I'm really committed to health care, not illness care. That's why I left the paradigm of internal medicine and geriatrics, because they do illness care. I'd rather take care of humans and promote health rather than naming illnesses and shooting at illnesses with random drug targets or drug guns.
Okay, well, that's given me a different perspective on this. And
Exactly.
So thank you so much.
You're so welcome. I like to change perspectives, because if you actually look at it the right way, you can do something about it. But if you actually submit to the system that tells you that you're dysfunctional, that you have a label, that your label needs treated, you're stuck in a paradigm that keeps you oppressed and keeps you buying crap from big pharma instead of just eating whole food and getting healthy. Let's do that instead. Let's make pharma go bankrupt, because we don't need to buy so many over-the-counter useless things. I really do think that pharma needs to be there, because we have some conditions that need some of the amazing medications that have been produced by our science. But to just use those things to try and build health is insanity. I mean, I feel really badly for the primary care doctor of today whose purpose is to maintain chronic illness. Who wants to? I sure don't. I want to get rid of all chronic illness across the planet.
Chronic illness. I've got so much chronic illness that I take 10 pills in the morning and another 6 or 7 pills in the evening. So there
you're on the path to continued worsening of your macular degeneration, because your pills are maintaining your ills. Let's get rid of the ills. Talk to a functional medicine doctor.
Okay, I will. And but I'm towards the end of my human life.
You're never too late to change.
That's true. I'm 73, but I had a triple hemorrhagic stroke.
Yeah, you sound great though.
I know it. I'm quite strange. I'm a quite strange person, and I'm an eccentric. So what do you want?
Well, I love that, because I'm quite eccentric.
Oh, well, we want to meet up one day.
Indeed. So have a great day. Good luck with that condition. Find a good doctor to help you get to the root cause of the problem.
Thank you. And I am going to have a second cataract surgery soon, so we'll have to see what happens with this other eyeball.
Indeed. Best wishes.
Okay. Bless you.
And to you too there, Sandy. I've got Kay, Kathy, and Gail in the line. So let's go to Kay. Good morning, Kay.
Good morning. Good morning,
Hello.
Dr. Harvey. I have a question for you. I've had gut issues most of my adult life, and I've, cut down on whatever's caused me, problems and whatever. But my question to you is, I've been reading up on, gut problems, and I've been taking Flora Store, and I'm just wondering, it's helping me. I've been on it for a week. I haven't had any pain. I just feel so much better, and I'm wondering what your opinion is, if you've heard of it.
Florastor is a probiotic that is different from most of the other ones that you would find on the market, because it's not a bacteria. Florastor is a nutritional yeast called Saccharomyces boulardii. And this is very similar to the yeast that ferments beer and bread. And our bodies kind of like it. And Saccharomyces does not like certain bad bacteria. There's one called C. difficile that causes terrible diarrhea associated with antibiotic use, and it will eat C. difficile toxin, and it will eat C. difficile to get rid of it and rebalance your microbiome. It also interferes with Candida, the yeast that bothers people, that causes vaginal yeast infections and thrush. And so the Saccharomyces fights that too. So it's a gut microbiome rebalancer. It's a very good product.
Oh, good. I'm so glad to hear that. Also, interesting, because I've been getting kind of like yeast, like the smell, down there. And then once I, and I'm like, well, why? This has never happened down there before. And since I've been taking this, it seems to be helping that also.
Well, that is really brilliant. I think that you probably were having some gut pains from yeast overgrowth, because there's a couple of conditions out there. People talk about SIBO, small intestinal bacterial overgrowth. There's also small intestinal fungal overgrowth, where you might actually have just too much yeast growing there, and you bloat and you ache and you get gas, and this can also alter that.
Okay. Also, I'm going to throw this out there. I'm not a doctor, but I'm wondering if my enzymes are just not digesting what I eat quick enough. And
that's possible too.
Bacteria, yeah.
Yeah, and you can see a functional medicine doctor who does functional stool testing. You won't find that from most gastroenterologists. There's maybe 1 in 1,000 GI doctors that will actually do these functional tests instead of just scoping you. But if you find a functional doctor who will do a functional stool test, like a GIFX from Genova or a microbiome 360 from Doctor's Data, you're going to get some really good information that will help a functional doctor help you rebalance your gut.
Do you do that?
Yes, I'm a functional doctor, and almost all of us are gut-based practitioners, because that's our biggest interface with the outside world, our gut.
Oh, okay. Well, I was going to actually call you, and I still will, to make an appointment. That sounds great.
Excellent. I look forward to working with you.
Okay, thanks, Dr. Harvey. Have a good day.
You too.
Okay, bye-bye.
Thank you there, Kay. I've got Gail waiting. Good morning to you, Gail.
How are you, Dr. Harvey? God bless you for what you're doing.
Thank you, sir. How are you today?
All right. Doing better than normal. I wanted to ask you what you would suggest if somebody came to you and they'd already taken chemo and radiation and things like that, and they have been all over the place with the other gambit that, not aware of all the functional type testing and tributes and so forth. But what would you do if somebody came to you with the been diagnosed with colorectal cancer, and then with an aggressive carcinoma and things like that, and you don't seem to, you've been all over the place and talked to the other mainstream doctors, and they, of course, say, well, we don't know what causes it, but we can give you this or that, and you end up with all kinds of problems anyway, diarrhea and constipation both, and which is a form, I guess, of constipation, and having trouble, having had stool trouble for, 60 years or whatever. And
yeah, I think anybody with the situation you're describing deserves to have a functional medicine workup. When people come into my practice, I start with a metabolomic test called it's from a lab called Genova. It's called the Nutra Eval. And what it looks at is what's going on behind the scenes, how your systems are working. Are your energy and toxin converting units, the mitochondria, are they functional? Do you have enough omega-3 fats? Do you have enough of the B vitamins to run the system? So it really does an in-depth look at how your systems are functioning. And then for anybody who's had chemotherapy, I like to look deeper at very specific vitamin levels. Vibrant America does a nutrient test, a micronutrient test that looks at everything across the board in your cells and in your serum. So we see where you have deficits, because most people that have gone through this kind of treatment have nutritional deficits. And so we need to fill in the gaps to get you better. That's where I start, and then we go from there.
Okay, well, if you've already taken all kinds of vitamins and things like that, and you have different kinds of tests that may or may not be right, but they say that vitamin-wise, I've taken everything from vitamin A, B, C.
Yeah, so you've seen a functional doctor and have functional vitamin and functional metabolic testing, right? Not mainstream testing, but functional.
Well, no, it's
Okay, so that would be the next step. If you've not done the functional testing, that's the next step, because the standard testing doesn't look deep enough. It looks at the surface area. So you want to look deep to find out what's going on inside your cells.
Okay.
That way you
what about
know what to take.
things, Doctor? What about these things based on algorithms? How effective are they, or is that something you should just forget?
I'm not sure what you're talking about.
Well, there's testing that goes into everything from your moods to everything that your spleen wants to set that a blockage in the.
What kind of testing are you talking about there? I'm not sure.
Well, just based on algorithms is all. Go ahead.
I have no idea what testing and what algorithm, so I can't give you an opinion because it's very vague what you're asking.
Okay. But what you resonate towards is based on resonation and things like that. Like, these things that you're, that they just had, how they got Maduro out of his place because of this secret weapon that works inside of you rather than the conventional things.
I think you've been watching a lot of interesting things on the internet that may or may not be connected to reality.
Right. I agree. You can't hardly tell whether something's actually true or not.
Actually, you know how you do that? You actually go to the source material and you look at the published data that's been scientifically evaluated. You don't watch YouTube videos with bobbleheads talking about inane BS that is absolutely crazy. So yeah, we need to not listen to YouTube videos unless we know that it's coming from a scientific source that's been vetted, because most of those bobbleheads are trying to sell you something stupid. I call them Insta-grifters.
Yeah, and you always have to look at milk does the body good, and then it's always sponsored by the Dairy Association or somebody.
Or something like that. Exactly. It's like they call them influencers. I call them affluencers because they get affluent off of your gullibility buying their product.
Yeah, that's true. Well, thank you so much. I could get into all this. I was an advocate for my mom for 8 years and kept her alive and went through 7 hospitals and 7 doctors before I got somebody honest. And,
well, you have been working hard. Way to go.
And I just really appreciate what you're doing. You do have an idea because you're you, but, things that you just think you're getting some kind of help, and you just can't believe that people would prefer money over trying to help people. So
you can't believe that? Oh my word! You're not living in the world today.
I've got to get more acclimated, I think, to all the lack of.
I sound cynical sometimes, but really, I'm an optimist with experience. I've watched the scams for too many years.
I understand. Well, thanks again, Doc. I appreciate it so much.
You're very welcome, Gail. Have a great day.
You too.
Thank you there, Gail. Yes, and I've had Kathy waiting quite patiently, and I believe she said she was driving, so I apologize for that. And I've got Brian and Annie on the queue as well. Good morning to you there, Ann.
Hi.
Hello, Kathy.
This is Kathy. Hey, how are you, dear?
What you got?
I'm going to try to be brief. I am parked, by the way. So first of all,
Good.
I want to say thank you because what you're doing for us is amazing. I love your sense of humor and just your perspective in general on life. So anywho, I'm almost 79 years old, work out every day. I'm plant-based, very into holistic and alternative ways of looking at taking care of myself. I'm on no meds at all. But here's my question. I'm ready to have cataract surgery. I'm going to see the surgeon this week, and
Yes.
I personally believe that if I can put it off for a while, that I might be able to heal the cataract in a more holistic way. I was told by my eye doctor that if I put it off, the pressure that they might need to use if it gets any harder would affect my macula, possibly.
Yes.
And
so here's the deal.
How does it have? Okay.
I have looked at this stuff, and in fact, back in like around 2000, there was a huge push for trying to heal cataracts with some certain antioxidant supplements, and they had some really good studies done in dogs that showed that the cataracts went away, but they were acute traumatic cataracts. So they weren't the age-related degeneration cataract that we humans experience, and so the ophthalmologist is right. The longer you leave it, the harder it is to deal with. And now I'm doing holistic medicine since 1996. All right. Mm-hmm. I have never seen a cataract get better.
Wow.
Ever. So I would suggest you listen to your ophthalmologist if you're having trouble seeing and he says they're ripe for removal. You're going to love seeing again.
True. I'm just very fearful of it. It's just a phobia I have. I've had, the only one I have. Okay.
There's a woman, Bella Ruth. I think about how you might spell Bella Ruth, and her last name is Naperstak, I believe. Bella Ruth Naperstak. She has a meditation for surgery. I'd suggest that you just listen to that meditation for surgery to prep yourself to go into this with good, positive feelings to improve your outcome.
I shall do that. Thank you. That's awesome, Saul. One more thing, Doc.
What's that?
I definitely am going to make a telemed appointment with you, but how do I find your updated shows? I've been on your .com, and I just can't locate them.
The shows? You just go on to thehealthystepsshow.com. And it will take you directly to the archive of my show on WMNF.org.
Okie dokie. Thank you so much. I love what you do. Much appreciated.
Glad to help. Have a great day.
You too. Bye.
And thanks for following us there, Kathy. Let's go to Brian in Tampa. Good morning, Brian.
Hello.
Hi, Brian.
Yeah. Hello. I was diagnosed with prostate cancer that's metastasized in my pelvis and spine 2 years ago.
Oh.
They removed my testicles to stop the production of testosterone. I'm doing okay. The numbers are very low. I was doing the pill version of chemo for a month, but then I got thrown off a bus and broke 2 ribs, and I decided I'm homeless, so it's kind of dangerous at times. So I decided not to do that treatment. But my question for you is, I'm very weak in the arms. I was wondering if steroids would benefit me.
Well, that is a difficult situation that you're in. Yeah, so, in a male, testosterone absence does lead to muscle wasting and weakness. And it does in women too, but men are so much more dependent on it. And yet you have metastatic prostate cancer, which responds to testosterone by growing. And so you're kind of caught between a rock and a hard place. You need the testosterone. You need not to have the testosterone.
Yeah, well, I don't have the testosterone.
Right. And so that's helping the prostate cancer, but you're now weak. So, there's this risk-benefit ratio we have to consider with everything. Your quality of life is deteriorated because you don't have testosterone, but the length of your life is extended. Were you to take testosterone to basically get your testicles back, essentially, you would probably get stronger and feel more vibrant, but then it's likely your prostate cancer would grow. So you've got...
Not testosterone. Not testosterone. I wonder about steroids.
No. Steroids just make you fat.
Oh, okay. They don't help your muscle strength.
No, the only steroid that helps your muscles is testosterone.
I didn't even know it was a steroid. Okay.
Yeah.
All right. Well, that answers my question. Thank you.
You're welcome, sir. Best wishes.
All righty. I do have Ann in Gulfport and just a couple of more minutes. So what have you got for us there, Ann?
Hello?
Hi there.
Hi. Yeah, I just have two things and a question. First of all, a European friend of mine taught me years ago that when you have a lot of mucus or you want to clear your head, take a clove of garlic, smash it, and put it in about, a little bit of water. Let it sit for a few minutes till the water gets cloudy, and then snort the water. Now, it works beautifully, but it does it makes the light go off in your brain.
Yes. Well, I would recommend that you don't do that in just water, but do the salt and baking soda water that is used in the neti pot. And once you crush the clove of garlic, let it sit for 5 minutes to activate the active chemical in there and make it go from inactive to active, and then mix it in the water, and you will have that effect. And it will change green mucus in your head to clear practically overnight.
Oh, yes. Well, it does it almost instantly. I've been doing that off and on for years if I need to clear my head. The
Excellent.
other thing is that I read a medical study and I saw it reiterated. I often listen to the People's Pharmacy. You're probably familiar with that show.
Yes.
What?
I know them.
Yeah, good, yeah. They have legitimate people on, and I read that melatonin, a small dose of melatonin, seems to prevent macular degeneration from proceeding to wet, and it just kind of keeps it in a stable condition. They had done a study on that, so that's another thing people could think about with that macular degeneration to stabilize.
I agree.
And the other question is I wanted to go to a functional medical doctor because I don't like Western allopathic medicine and rarely go to the doctor. And one that I called here locally wanted $950 for the first visit and doesn't take Medicare.
Right. And that will be the case quite often because Medicare is designed as a acute illness care modality, and functional medicine is a chronic wellness care modality, totally different because your Medicare and all illness insurance pays for illness visits, but it doesn't pay for wellness visits.
Uh-huh. So, I'm talking regular Medicare. I'm not talking Advantage plan.
Yeah, regular Medicare is an illness-based insurance. It covers your economic loss from having an illness. And so if you don't have an illness, it doesn't work. And if you're looking for wellness, functional wellness is not something that is covered within the area of Western medicine, period, end. Thank you.
Yeah.
I'm going to move on to emails because we're down to the last minute. Thank you.
Doctor. I'm just surprised it's so expensive. Thank you. Bye-bye.
Well, that is the kind of time for money that is actually covered by Medicare. Medicare underpays all thinking doctors. Medicare is controlled by specialists. They overpay for specialty intervention procedures, and they underpay for thinking medicine. That's why we're in such a crisis of illness care overcost now, because we pay for too many procedures and we don't pay for thinking of how to avoid the procedures. It's a really sad situation. But I want to thank everybody for calling in today because it's been very, very stimulating as usual. I love y'all and I love doing this. So I'll see you next week for another one. Thank you, Bill, for hosting in-house, and Sage for screening all these calls for us. Have a great week.
And thank you, Doctor, for a wonderful show. Again, always illuminating. And it was Joe answering the phones today. So thank you, Joe. As usual, you came on through in the clutch play. I'd like to thank all of our listeners for participating, and all of the folks on out there. Stay healthy, stay safe. You have been listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa.